Hi everyone, this is Dr. Rachel Spears and welcome to my channel. So today we are going to be talking about all things exercise. And I get a lot of patients who'll come to me and they'll say, well, when should I exercise? Should it be in the morning or at nighttime? How long should I exercise? And do I need a trainer? Well, we're not going to even talk about any of that. We're going all the way down to the basics. So when I think about exercise, I categorize them into 5 different groups. And so the first group is going to be your cardio. Number 2 is your strength training. I apologize for my handwriting. Number 3 is movement. 4 is going to be balance. Balance. And 5 is other, kind of like your HIIT training, that high intensity interval training, which has a combination of the others. So when we talk about cardio, right, we're more so looking at increasing our endurance, right? And for strength training, we're increasing our muscle and our bones. Now, I'll tell you, for women 40 and above, we absolutely want you to do some strength training to increase that muscle. For movement, this to me is more like Tai Chi. It really hones in on that relaxation. Sorry, my spelling. On that relaxation, being able to kind of connect with your breathing techniques and zoning out. And then balance is more that yoga, where it supports your posture. And then, of course, the HIIT training, that high intensity interval training, that's going to combine all of them. So what do all of these exercises have in common as far as the benefit of them? They all help you to decrease high blood pressure. They help to increase your body's ability to use oxygen. And they help to push glucose, especially your strength training and cardio. It pushes glucose into your muscles. And so ultimately that's going to reduce the glucose from out of your bloodstream, which will ultimately reduce your risk of getting diabetes. Now, one of the things that I always ask people to think about when they are trying to choose which exercise is right for them, there are about 3 questions. The first one is, does it hurt? Right? You don't want your exercise to be so strenuous that you can't even get out of bed the next morning, or you hurt yourself in the process of doing it. The second is, do you enjoy it? You want this to be something that you look forward to doing versus dreading doing. And the last question is, do you struggle trying to get it done, right? You might like, for example, playing tennis, but maybe you are struggling just to really get an understanding of how to do the serves and trying to get back and forth through the court. So again, you want this to be something that you look forward to and that you feel confident in doing. So I help women who are struggling with weight loss, brain fog, poor sleep, to get to the root cause of things by keeping it very simple. If you have any questions, feel free to leave them in the comment section down below. I encourage you to subscribe to my channel and can't wait to see you next time. Bye.